now my pleasure to turn the presentation over to Rani Jeeva and some interesting training materials that are just coming to be released. Rani?
Thanks, Dr. Battles. So there is a wide array of healthcare-associated infection prevention resources and tools available from the various components of the Department of Health and Human Services, or HHS. Two such resources or programs will be highlighted here. The first is a computer-based video simulation training program called Partnering to Heal, Teaming Up Against Healthcare-Associated Infections, which was launched in May of this year. This training program permits viewers to become one of 5 characters who would make decisions that impact health behaviors and risks, and then view the results of those decisions and learn from the outcomes. The training is designed to be used by students in the health professions, early career clinicians, and other healthcare personnel, as well as patients and families. We are also hearing from folks across the country who are using the training in their infection control and prevention programs and orientation sessions at their institutions. The training program promotes a team-based approach to reducing preventable infections and focuses on principles of teamwork, communication, hand washing, vaccination against seasonal influenza, and the appropriate use of antibiotics and medical devices. Partnering to Heal is available online at no cost and can be accessed at the address listed on the previous slide. And in order to appropriately introduce the training, we have a video clip which we will play here.
I understand where you're coming from. However, it's critical that we report as honestly and objectively as possible according to the guidelines that we're required to follow. Let me show you why.
It just seems that you're ignoring a host of factors in order to reduce our work to a few numbers.
I know it seems that way, but it's important to use standardizing criteria. We use the National Healthcare Safety Network criteria. We take our data and we put it in their database and generate reports. Then we take the data and turn it into information that we can use in our quality improvement activities.
So you fully explain the criteria and look for ways to improve care.
The patient clearly met the criteria. Although it was a superficial infection, we've seen many of these cases later on develop into deeper infections. As you know, we'll take this to the committee and it will be peer-reviewed. But the more important issue is to look at what we could have done to prevent the patient from developing an infection in the first place. I'm more than willing to work with you offline to explore ways to prevent SSIs. There are many opportunities, such as standardizing our surgical prep procedure, assuring timely antibiotic prophylaxis, and educating our patients on their job in preventing infections.
I appreciate that. And look, I'm on your side. I want those numbers down as much as you do. But I'm just not sure that the numbers reflect the complexity of what we're doing.
The data are risk-adjusted. But it is our job to investigate the nuances of each case to determine how to improve care.
And as you continue the conversation, you turn the confrontation into a teachable moment. You end up enlisting an ally instead of simply winning an argument over reporting criteria.
Another HHS-sponsored program is the National Awards Program to recognize achievements in eliminating healthcare-associated infections. Last year, HHS partnered with the Critical Care Societies Collaborative to develop and implement the awards program. The Critical Care Societies Collaborative is a multidisciplinary organization comprised of leaders in medicine, nursing, pharmacy, and respiratory therapy who serve the nation's acutely ill patients. The initial phase of the awards program recognized critical care professionals and healthcare institutions that have achieved success in reducing central line-associated bloodstream infections and ventilator-associated pneumonia. Awards were conferred at 2 levels according to specific criteria tied to national standards. The Outstanding Leadership Award went to teams that had sustained success in reaching their reduction targets for 25 months or more. The Sustained Improvement Award level recognized teams that demonstrated consistent and sustained progress over an 18 to 24-month period. In May of this year, we were pleased to announce the initial group of 37 awardees in the program's first year. Awardees represented the diversity of institutions in which healthcare is delivered, from small to large bedside hospitals, adult and pediatric facilities, as well as institutions serving rural populations. The full list of awardees is available on the HHS Office of Healthcare Quality website at the web address listed on the slide. And in coming years, we hope to expand the awards program to other areas and to non-hospital settings. 2 of our outstanding leadership award winners who have achieved success in reducing central line-associated bloodstream infections in their organizations have graciously agreed to join this webinar and present their stories. We hope that these stories will serve as examples for how teams and institutions have approached healthcare-associated infection prevention and have overcome various obstacles in their journey.